This is my 15.2 video on responses to injuries. So starting off with physiological responses to injuries. So we have strains, and this is an injury to the muscle. This may be a twist, a pull, or a tear to the muscle or tendon. This can be caused by overstretching, and there are three different grades to the strain. So grade 1 is a pull, and this is when less than 10% of the muscle fibers have been damaged. In this case, the athlete can carry on with their sport, however, there might be a slight discomfort, so it is advised to stop. Grade 2 is a muscle tear. This is when 10 to 15% of the muscle fibers have been damaged. This causes swelling, inflammation, and the athlete will not be able to carry on with their performance as they will be rather immobile. So grade 3 is a muscle rupture, also known as the muscle being detached, and this is where 50 to 100% of the muscle fibers have been damaged. This can cause severe pain to the athlete, and there will be severe swelling too. So next we have sprains, and this is an injury to a ligament. This may be a stretch or a tear or a rupture to the ligament, and it is caused when the joint is forced beyond the range of movement. Again, like a strain, there are three different types of grades. So the first grade is a stretch to the ligament, and this will cause pain for a couple of days, but the range of movement is okay, and the athlete will be able to carry on depending who they are and depending on their pain threshold, I guess. There will be swelling and some inflammation of the area. So grade 2 is a teared ligament, and this is often caused when the ligament is overstretched. So there will be swelling in the area as well as it being inflamed again, but it won't be very stable, and the range of movement will be very low to moderate. The last grade, so grade 3, is a ruptured ligament, and this ends with there being no stability for the athlete as well as very, very low range of movement. The range of movement, there would just be a lot of swelling as well as a lot of inflammation to the area. So next we have two different types of hematomas. This is, so a hematoma is where there is solid swelling of clotted blood within the tissue caused by blood collecting outside of the blood vessel. So the first one is intermuscular hematoma, and this is when bleeding spreads into surrounding tissues. So as you can see from the diagram, the blood is like spreading and not just staying in one place. So an example of this would be if someone did a sliding tackle in football, so it was also a high tackle, so like hitting their thigh, and their studs went into the leg at high speed and power. So the bruise will not just be in one small area, it will most likely spread over the whole thigh. So the second one is an intramuscular hematoma, and this is where bleeding is contained within the muscle fibers and does not pour into the surrounding muscle tissues. So an example of this could just be a jab in the head in boxing. The hit will cause a small bruise and maybe a lump or an egg on the head. However, it will be contained within that area. So here we have the blood clotting mechanisms. There are 4 different stages to this mechanism, and these stages help control the bleeding so that the bleeding can stop and it can reduce the amount of blood that is lost. So within the process there will be damage done to the blood vessels which then exposes the collagen fibers. So stage 1 is the platelets are activated by the exposed collagen, and these platelets form a plug. Stage 2, the clotting factors help reinforce the platelets, which means the plug begins to get stronger. stage 3, this is when many fibrin molecules polymerize, meaning that they create a web and trap more platelets. Stage 4 is other cells, and these cells could be red and white blood cells, and they help form a clot to seal the wound and ensure the plug is sealing the wound well. So on the next slide we have stages of healing, and there are 3 different stages of healing which all have different time periods. So the first stage is inflammation, and this is where the blood vessels constrict and seal themselves off as the platelets create substances that form a clot and halt the bleeding. So this stage takes 4 to 6 days, as seen on the graph below, on the orange part of the graph. The second stage of healing is repair, and this is where the wound begins to form new healthy tissues. But for the new healthy tissues to be formed, there must be a sufficient supply of oxygen as well as nutrients. So as seen on the graph and on the blue bit of the graph, the repair stage takes 4 to 24 days. In this stage, the colour of the tissue is an indicator of the wound's healthiness. So if the tissue is dark, then this is a sign that the wound is infected, so that's a bad sign. Whereas if it's a pinkish colour, then it's a sign that the wound is healthy and it's getting better. So the third stage of healing is remodelling, and this is the last stage, and it can take 21 days to 2 years, and that's seen on the purple bit of the graph. So this happens when the wound has closed up and during this phase the tissues are remodelled and the non-functional fibroblasts are replaced by new healthy ones. So now moving on to psychological responses to injuries. And we're going to start off with the stages of grief. So as seen on the screen, there are 5 different stages of grief, which most athletes will go through when they gain an injury. So some athletes may miss stages or relapse and go through stages twice, but these are the overall stages of grief that are an average kind of. So the first stage most athletes will go through is denial, and this is like a defense mechanism. So the athlete will not want to accept what's happened to them and the severity of the injury, and therefore they find it hard to admit to themselves that they need to rest and just take the recovery stages. So an example of this would be if someone got injured during a rugby match and the physio was telling them that they needed to get off the pitch, but they keep denying the fact that the injury is bad and say they just need to walk it off and they'll be fine to carry on. However, we know that the injury is very bad and that by carrying on they would make the injury much worse. So the second stage is anger, and this is when the athlete will begin to feel the pain of the injury and begin to realise that the injury could be potentially bad. The athlete might begin to get angry at themselves, others, or the person that caused the injury. So an example of this would be if someone gets injured due to a sliding tackle in football, and then the injured athlete begins to get angry at the other athlete that caused the injury because they realise that they could miss the season. The third stage is bargaining, and this is when you try to delay the consequences of the injury. So this may include bargaining your recovery time, so saying that you don't need as much recovery time as you actually do. So an example of this could be if a rugby player has gained concussion from a bad tackle, then they begin to bargain with their manager and the physio, saying that they'll be able to go back on the pitch in 2 minutes and proceed playing. That if you do have a concussion, you need to take the whole game off and rest. The fourth stage is depression, And this is when you begin to realise how bad your injury is and you begin to feel sad and upset. An example of this would be beginning to feel isolated as you're missing out on training and games due to your injury. The fifth and final stage is when you finally begin to realise the true severity of your injury. So you begin to become a little more joyful as you're ready to start the recovery process, and this also means that you might become a bit more motivated. So putting this into an example, you would be starting to go through physio sessions and putting 100% in because you know that if you do put 100% of your effort in, it might potentially speed up your recovery time. On this next slide, we have the different emotions of an injury. So when an injury takes place or during your recovery process, you're going to be feeling a lot of mixed emotions. And of course, this only applies to a few athletes, but most athletes will go through some of these emotions. So starting off with fear. So you may be fearful of what the verdict will be on your recovery time. So you might also be fearful of relapse. So fearful of your recovery time will be like as soon as the injury has happened, you won't know how long you're going to be out for, so then you're fearful of that. But if you're fearful of relapse, that's going to be when you've come back from recovery. So next is anxiety or stress. So at the point of the injury, you may be scared because you don't know the diagnosis. This therefore means you're left in the dark about the recovery time until you have seen a professional and they can tell you how long you'll be out for. As well as this, the anxiety can be carried through till after the recovery has happened. So it's a bit like fear when you're going to be worried and anxious about relapse of the injury. So next we have frustration, and this is when you will be questioning why the injury has happened to you and why it happened at that moment. This can happen during and after when the injury occurs. Next we have isolation, and this may occur after an injury has taken place when you cannot participate in training or games and you feel like you're missing out on social events, training, and yeah. So the next is lack of motivation, and if an athlete can see that their skills and abilities are deteriorating because they cannot exercise due to the injury, they might not feel very motivated to recover as they feel angry and annoyed that they got injured in the first place. So the next one is low confidence, and if the athlete has missed out on a lot of training and games, their fitness and skill ability may have decreased. This means that their confidence will have decreased as well. So on top of this, when they get back from recovery, they might lack confidence when training as they don't want to injure themselves again, and therefore they don't have much confidence when playing. So an example of this would be if they have a lack of confidence, they might not put 100% into a tackle. So yeah. The next one is denial, and this can happen when the injury occurs in the recovery phase, and it's when the athlete cannot admit to themselves the severity of the injury, and this is purely a defense mechanism. The next one is anger, and this can occur when the injury takes place in after two because you begin to get frustrated at others as well as yourself. The final one is depression, and you might feel depressed due to the isolation and start feeling low and negative and put yourself in a bad mindset. So it's essential that you stay in a positive mindset while in the recovery for an injury.